Dear friends who are committed to ending tuberculosis globally, JATA was established in the year 1939 under the imperial mandate of Her Majesty the Empress. The current patroness is Her Imperial Highness Crown Princess Akishino. For more than 80 years since its establishment, JATA has been at the forefront of tuberculosis control both nationally and internationally in areas ranging from basic clinical research to epidemiological field studies. In my view, the key to ending tuberculosis globally is further strengthen global capacity in the area of research and development. It is in this context that JATA is looking forward to collaborating with any of you interested in capacity building, particularly in this area.
The Research Institute of Tuberculosis plays a central role in JATA's tuberculosis control initiatives.
Greetings from Kyose, city with long-standing history of battle against tuberculosis. The strength of RIT JATA is that we have dealt with wide range of areas related to global and domestic TB control, such as basic, clinical, epidemiologic, and operational researches, as well as technical support to many organizations. We have networked from the experience in training and technical cooperation as a WHO collaborating center.
RIT JATA actively supports tuberculosis control efforts in various countries, focusing on providing technical assistance and developing innovative products.
RIT JATA supports operational researches of active case finding using ultra X-ray equipment with computer-aided diagnosis in Nepal, India, and the Philippines.
RIT JATA has 5 key departments, each playing a unique role in the global fight against TB.
Our department is at a supranational reference laboratory in the Western Pacific region WHO. We are doing some basic studies and also that applied researches. Recently, we are working on the bioaerosols for the transmission analysis of mycobacterial tuberculosis and also utilizing the bioaerosol for TB diagnosis. So we developed some kind of filter masks, and then that can detect the mycobacterium tuberculosis DNA and also quantify it.
Since 2016, they began whole genome sequencing with Asian countries. Initially used for TB drug susceptibility testing, it's now also applied to analyze TB transmission between patients using genetic variants.
Recently, that the whole genome sequence data is indicating that, clearly showing that we have some expansion of some certain strain, and that in Japan, in certain area, we identify that using our whole genome sequence capacity.
The Mycobacterium research guides its application as technical assistance to TB control efforts in Japan.
For example, we have investigated TB outbreaks in a workplace, a psychiatric hospital, or in a Japanese language school where a large number of foreign-born students. In relation to TB outbreaks, we have data on over 600 TB outbreaks that occurred in Japan from 1993 to 2015.
To apply research findings to practical measures in the field, RIT JATA contributes to the development of 2,000 Japanese professionals each year.
We conduct training programs for doctors and public health nurses from all over Japan.
Since 1963, RIT JATA has taken pride in its extensive global network of professionals, welcoming and training more than 2,500 international participants from over 100 countries and regions. Moreover, it actively utilizes this network to support TB control in developing countries, such as Cambodia, where RIT JATA has been assisting with national TB prevalence surveys for approximately 20 years.
At that time, many people believed that passive case finding was good enough to diagnose TB patients.
However, the survey's results changed TB control strategies.
Currently, subclinical TB, which doesn't present typical TB symptoms, become fully recognized, and active case finding by chest X-ray has been considered one of the important tactics for ending TB.
Even under low prevalence conditions, epidemiological research using big data is essential for long-term TB control.
Recently, population research was conducted to examine the usefulness of measures to support the continuation of treatment of foreign-born tuberculosis patients in Japan. It was clarified, continued treatment after returning home. It is important to build the relationship of trust between the supporting side and the patient.
To effectively fight against TB, we need to understand its cellular level interactions with the human body. RIT JATA is also conducting research on pathophysiology and host defense. The RNA expression analysis of TB patients' blood samples and the experimental mouse infections are being used to find new tuberculosis biomarkers. The research has involved over 800 TB patients and 500 healthcare workers, aiming to identify host factors related to expanding Mycobacterium tuberculosis strains.
We expect that predicting progression from latent TB infection to active tuberculosis and earlier diagnosis of TB patients. A long-term clinical and epidemiological data has been accumulated, and we believe that these studies are very important to identify host factors associated with TB to control TB altogether.
In order to eliminate a pathogen like Mycobacterium tuberculosis, which has a long history of coexistence with humans, they believe that new ideas are necessary.
We always try to develop new methods and new tools that use the latest technologies, and we think that this is also very exciting for the young researchers.
For decades, RIT JATA has led the fight against TB with new technologies and strategies. They will continue to confront this disease on the front lines.
Tuberculosis is in a state of chronic pandemic. The innovative research is the key to eliminate TB. JATA is determined to take on squarely the challenges ahead of us.